Recording has started and the timer has been set. You can enter your exam room whenever you're ready.
So I close the door?
Yes, you can.
Good morning, Radiology. This is Dr. Morrow.
Yes, Dr. Morrow, this is Dr. Jamie Dugan. I'm a little concerned here. I have been having the girls in my office repeatedly have to chase down the status of the report that we sent to you for a patient. Can you tell me where that report is?
Yeah, let me see what I can do for that. First of all, just give me the patient's name if you don't mind.
I'm not sure that I have the patient's name. It's an
Okay.
it's an MR on a left knee, and apparently we're waiting to see whether this patient needs surgery. She keeps calling the office, and the girls just have given it to me. But I don't understand what the holdup here is.
Yeah, it sounds like it's very frustrating for you and the patient. I apologize for that.
And not only that, this is the wife of one of my colleagues. This is beginning to be extremely embarrassing on my part.
Yeah, I understand how that may look on your end, and once again, I apologize. I'm not sure if you're aware, but we have moved recently to a new dictation system, and that has slowed things down. But, I want to reassure you that I'm going to find this specific this specific report and see if I can't get it to you right away. Make sure it's done. If it's not done, we'll make sure it gets dictated and it won't get lost in the shuffle. So, if you don't know the name, I want to make sure that when we get off, I speak to one of your staff to make sure I get that name.
Is this that new Power Scribe that you've gone over to?
Correct, yes.
The thing is, we've never had a problem with you. We have always had, a good relationship, and things have always gone smoothly. But I have to tell you, since that Power Scribe, this is not the first time that we've had to call over and chase down a report.
Yeah, it's once again, I understand it must be frustrating for you. It's also frustrating for us because we don't want it to reflect poorly on us and what we do. And as you mentioned, we've had good rapport in the past, and we don't want to jeopardize that. So, I think it's a kind of something that will hopefully work itself out. We're going to keep definitely on top of it. And in the meantime, the best thing I can do is just kind of, have you can be reassured that I'm going to take this one, make sure we get it taken care of, get this report out quickly to you, and then, going forward, I want to collaborate with you to make sure that you kind of track these and see, how these things are going and what the new system is. But unfortunately, this was a necessary thing that we had to do, and it's going to, in the long run, end up being a better situation. I just hope that struggling through these times where we're kind of introducing it and getting used to it doesn't affect us long term.
I hope that's true, and I'm, on your part, I'm not trying to tell you how to run your office. All I can tell you is, we need the reports in a timely fashion, and I can't be, I give this to my office staff to follow up on. I can't be taking time from patients to be personally chasing down reports. And the other thing is, I would like some reassurance that this isn't going to occur again in the future. Maybe you need to be thinking about another program, or, again, I'm not trying to tell you how to run your business, but I have to tell you that I'm thinking about, if this happens again, going somewhere else, because this is not the first time.
Yeah, well, I obviously I don't like to hear that we value you, we value our relationship, and like I said, the rapport we've built. I would hate for you to go somewhere else, but I can understand how once again frustrating it must be, how difficult it is. I know it's not easy for you to take time out of your schedule, and I hate that. And rest assured that as much as I am sure that this is something that will eventually work itself out, the kinks will be worked out. I would imagine that if it's something that continues, that we're going to have to look at something else. But in the short term, I know that we're really trying to keep an eye on things and monitor things. So we really do appreciate you calling. I don't want you to have to do any more work than is necessary or tracking everything down. That's not your job, and I know that is difficult, and I hope that it hasn't caused a lot of consternation amongst you or your practice, because I would hate for that to affect our relationship. So going forward, I think it's something that I will definitely take up to the group, and it's something we're aware of and will continue to work on.
Okay, so at this point, and I appreciate that, but today, what can we do? Like, how can I get this information? Because, again, I have this patient coming in for an office visit later on this afternoon, and I just don't want to say to her again, I don't know what's going on.
No, so what I will do right now, like I said, I think I have a short-term plan and a long-term plan in terms of this conversation. What I'd like to do, if you're not for sure of the name or medical record number, date of birth, all that, once we get off the phone, I will speak with one of your staff, get that information, make sure that study has been read, get the report, and fax it over right away.
I would really appreciate that.
And if it hasn't been read, I'll read it myself personally and get
Okay.
you the report. If there's something wrong with the system that doesn't allow it, I'll make sure and verbally talk to you about what the findings are, and I'll do everything I can to get you a report by the end of the day. And then going forward, like I said, and please take this back to the rest of the people in your group, I will personally take this on with the group and talk to them and make sure that they know, because I don't think you're the only person that's called. So I think, unfortunately, and I hope our past experience will go forward and let you know that we're going to take action on this, and we're not going to let it affect our relationships going forward.
2 minutes remaining.
All right. Well, again, I do appreciate that, but I think that before we make any definite decisions here, I would like to see what does happen, in the future. So I think I'm going to wait and withhold a little bit at this point, but I do appreciate you getting back to me as soon as possible with this information today.
Well, definitely, Dr. Dugan. Like I said, we value our relationship, and it's great collaborating and taking care of patients together. And we would hate for you to go off and use someone else. And I think because we've established that relationship. So yeah, please just hold off, because I think that we're not going to let things flounder. We're willing to take a little bit, but I think we want to get things pulled in a lot tighter, a lot sooner. If it's not going to fix itself soon, we're going to make sure that we don't let it get out of control.
I do think that would be wise. All right, thank you.
Thank you so much, Dr. Dugan.
I'll hear from someone this afternoon.
All right, I'll have my staff call your staff. We'll get everything done, okay?
Great, thank you.
Thank you.
Bye-bye.
Bye-bye.
line, please?